First aid awareness training. The first aid training and certification process takes just a few hours to complete, but can help you deliver the care that someone needs while waiting for medical professionals to arrive. When you understand first aid, you'll gain the ability to help those in need. Through our first aid certification classes, you'll learn how to respond to specific situations, which will help you care for people in crisis as they wait for medical professionals to arrive. Whether you take an in-person class, an online course, or take advantage of our simulation learning experience, which combines online coursework with in-person training, you'll learn from some of the best in the industry. Knowledgeable, understanding, and able to deliver information suited to a wide range of learning styles. Not every job is dangerous, but every employer is responsible for the safety of their employees in the workplace. One of the best ways for employers to meet their legal and moral obligations to their employees is to provide first aid training to employees. Having employees trained provides benefits that aren't always obvious. In this article, we'll look at some of the ways that first aid training can benefit both employers and employees. Benefits for employers. 1. Faster response during an emergency. In the event of an emergency, a fast employee response can save lives. Employees trained in first aid will understand the steps to take during an emergency, thanks to increased confidence and preparation. A quick response can reduce recovery time, leading to less time lost from injuries. 2. Reduce workplace accidents through awareness. First aid training helps employees learn to be more conscious of safety in the workplace, leading to a reduced number of accidents and injuries. Minimizing risk to workers and decreasing workplace incidents is a benefit to everyone, but for employers it has implications within all aspects of business operations. 3. A more positive work environment. By making first aid training available to employees, employers can show their workforce that they care about providing a safe work environment. First aid training provided in the workplace can even be used as an excellent team-building exercise and morale booster. Benefits for employees. 1. Safety in the workplace. Employees benefit from others around them receiving first aid training because it keeps them safer. Besides the benefits to employers that we've already noted, a safe work environment is an attractive benefit for employees. 2. Safety at home. Training in first aid is just as useful outside of the workplace. Knowing first aid could someday help to save the life of a friend or family member. First aid training is especially important for anyone living with someone at risk of cardiac arrest. Area covered in this training. 1. What is first aid? 2. Aims of first aid. 3. The responsibilities of the first aider. 4. Delegation, confidence, communication. 5. Incident, casualty priorities. 6. Multiple casualties. 7. Staying safe during first aid danger. What is first aid? The treatment given for any injury or sudden illness before the arrival of an ambulance, doctor, or any other qualified person. Whether the workplace is an office or a construction site, it has two common traits: valuable employees who may be injured or become ill and the need to protect them with adequate first aid procedures. First aid is the care a sick or injured person gets before they get full medical treatment. In some cases, it may be the only care someone needs, while in others, it may keep them safe until paramedics arrive or someone else gets them to the hospital. Aim of the first aid. 1. To preserve life. 2. To prevent the condition getting worse. 3. To promote Responsibilities of first aider. 1. Assessing the situation. What happened? Number of casualties. History, signs, symptoms. 2. Protecting from dangers. Assess for further danger. Protect yourself first. 3. Getting help. Ask bystanders. Which emergency services? Recognize your limitations. 4. Prioritizing treatment. Most urgent thing first. Most urgent person first. Offer support and comfort. 5. Minimizing infection risks. Wash hands before and after giving help. Wear disposable gloves. Wear protective clothing if needed. Cover your own cuts with a plaster. Dispose of contaminated waste carefully. Use sterile, undamaged, in-date dress. Philosophy of first aid. In the pre-hospital setting, the key contributors to survival and recovery from illness and injury are prompt and effective maintenance of the body's primary functions. 1. Airway. 2. Breathing. 3. Circulation. 4. Bleeding control. Principles of emergency care. Collect the detailed history of accident either from the victim or from anyone who has witnessed the accident. A. The victim's injury should be examined thoroughly, taking note of every symptom, to know the correct diagnosis. B. By the help of the diagnosis, treat the victim until the doctor arrives or shift the victim to the hospital and aid the patient during transport. C. Call the doctors or shift the victim to the hospital as soon as possible, so that the patients can recover soon from doctor's treatment instead of prolonging the first aid kit. A well-stocked first aid kit is a handy thing to have. To be prepared for emergencies. Keep a first aid kit in your home and in your car. Carry a first aid kit with you or know where you can find one. Find out the location of first aid kits where you work. First aid kits come in many shapes and sizes. You can purchase one from the Red Cross store. Your local drugstore may sell them. You can also make your own. Some kits are designed for specific activities, such as hiking, camping or boating. First aid kit. 1. Dressing. 2 absorbent compressed dressings, 5 by 9 inches. 25 adhesive bandages, assorted sizes. 1 adhesive cloth tape, 10 yards x 1 inch. Sterile eye dressing. Gauze pad. 2. Equipments. Tweezers to pull out stings. Scissors to cut dressing, bandage. Oral thermometer, non-mercury / non-glass. 2 pair of non-latex gloves, size large, safety pin. 3. Medications. 2 hydrocortisone ointment packets, approximately 1 gram each. 5 antibiotic ointment packets, approximately 1 gram. 5 antiseptic wipe packets. 2 packets of aspirin, 81 milligrams each. 4. Bandages. 1 roller bandage, 3 inches wide. 1 roller bandage, 4 inches wide. 5 sterile gauze pads, 3 by 3 inches. 5 sterile gauze pads, 4 by 4 inches. 2 triangular bandage. First aid in emergencies. First aid is the immediate care given to victims of accidents before trained medical workers arrive. Its goal is to stop and, if possible, reverse harm. It involves rapid and simple measures such as clearing the air passageway, applying pressure to bleeding wounds or dousing chemical burns to eyes or skin. Before treating to anyone. Check. 1. What happened? 2. Further danger? 3. Can you cope? 4. Number of casualties. 5. Emergency services. 6. Who needs help first? Asphyxia / choking. Definition: asphyxia means one of the respiratory problems where lungs do not get sufficient supply of air from breathing. Signs / symptoms: blue discoloration of face, tongue, and lips, gasping, inability to speak, unconsciousness. Actions: 1. Remove the casualty from the affected situation. 2. First, try grasping the victim from behind with hands linked in front and compressing the abdomen just below the ribs. 3. Encourage victim to cough up foreign objects in throat. As a last resort, wrap victim between shoulder blades to dislodge object. 4. For asphyxia caused by gas or fumes, remove victim to a clear atmosphere. Use artificial respiration. 5. Open the airway and begin to give mouth-to-mouth ventilation immediately. 6. Place the patient in a recovery position. 7. Apply water over the face, make the patient to drink a sip of water. 8. Scent the casualty during the choking and asphyxia. 1. Lean the person forward and stand behind him. 2. Make a fist with hand. 3. Make a quick, hard movement inward and upward. 4. Or you can press lower abdomen by chairs or any strong objects. 5. For kids and infants, place the infant's stomach down across your forearm and give 5 thump on the infant back with heel. For no breathing, administer CPR, cardiopulmonary resuscitation. A. Lay the person on his or her back. B. Give chest compressions. C. Tilt head slightly. D. Breathe into the person's mouth. E. Continue until ambulance personnel arrive. Pulmonary resuscitation CPR. 1. Check in danger. 2. Check response. 3. Check airway or breath if not there then. 4. Open airway by lifting head from chin. 5. If breathing appearing then call to ambulance. 6. If no breathing then start CPR 30 compressions and 2 breaths. During CPR we will have to do DRABC. D for danger. R for response. A for airway. B for breathing. C for circulation.
To learn CPR. The only thing required is your 2 working hands and your intention to save a life. If you feel that a person is clinically dead, make him lie down on a hard surface like the floor. It should not be the bed, it should not be the couch, it should not be the sofa. Now you need to confirm whether the patient is actually dead or not. Very simple. First of all, a person who is clinically dead will not respond. So produce a pain in any area, and if the patient has no response, look for respiration. Either hold your hand in front of the nose, there will be no warm air coming, or you see there is no movement. Presume that the patient is clinically dead. Once you have clinically confirmed, push hard, act fast. So what you have to do is stand on your knees, interlock your hands, straighten them, and take the palm and keep it on the center of the chest in between the 2 nipples, and then come forward so that your shoulders and hands are in a straight line, and then push hard and push fast. Hard means at least 2 inches and fast means minimum 100 to 120 times per minute. And you can speak 1, 2, 3, 4, 5, like that. You can continue speaking. Continue this hands only CPR till the person revives or an ambulance appears with an electric shock machine. Yes. So whenever you are doing CPR, ask for help. Hey, somebody call the ambulance, and ask the ambulance to bring an electric shock machine and continue CPR. So sometimes you have a person who says his one hand is not working. What to do it? You can do it with your elbow. You can do it, push hard. 1, 2, 3, 4. You can do it like that. So suppose a person has no hands, he can do it with the leg. See here, 1, 2, 3, 4, 5, 6, 7, 8. So is it difficult? No, absolutely not. Even a 4-year child can learn. Even a 99-year-old man can do it. So everybody can learn it. The only thing you have to remember is push hard and push fast. Minimum 2 inches, minimum speed of 100 to 120 per minute. And if you do that, you can